We've talked a lot about the problem of insulin resistance, this terrible vicious cycle that people often get into where they create higher levels of insulin, more hunger, more fat storage. How do we break this vicious cycle? Well, fortunately, there are drugs that we can use that help improve the insulin sensitivity and desensitize you effectively to the effects of insulin. The first of the drugs that have come available is something called Metformin, which is also known by the trade name glucophage. Metformin, interestingly enough, is one of the first drugs that actually reverses the problem of insulin resistance and makes your body react better to the effects of insulin. By doing so, it tends to reduce hunger, it tends to reduce fat storage, and it helps manage blood sugar in diabetics more efficiently without driving up and creating this whole vicious cycle we talked about. Now, Metformin is a drug that may be useful for you if you have diabetes, and it's something that you should talk to your doctor about. There are certain situations where you should not take Metformin if you have kidney disease or if you're older. But many people can find that by switching from certain types of drugs that raise insulin to drugs that make them more sensitive and responsive to insulin, they find it much easier to lose weight. So this is definitely a discussion you should have with your physician. And now many obesity specialists are even taking to Metformin as a drug to help people who don't even have diabetes restore their insulin sensitivity and help them lose weight more effectively. So again, ask your doctor if this is something that is appropriate for you and might help you tackle the battle of insulin resistance.